Imagine a community where there's very high obesity and diabetes rates. Now imagine an approach to this problem, where there are home visits and screening question and finger prick tests done by nurses and community health workers, where residents that are screened positive are then referred and connected to care, where those who are in care then receive a diagnosis and a treatment plan and counseling, and where there are community reinforcers such as low and no cost health education classes and nutritional counseling and cooking classes, and where there's outreach to encourage healthier choices in surrounding neighborhood stores and markets. This is exactly what happened in the Humboldt Park community of Chicago, and it resulted in improved rates and better health for community residents. This is an example of how healthcare and public health can work together to extend and promote health beyond the walls of the clinic and actually change the context for healthier communities. This story is also a metaphor for the historic period of change and opportunity that local health departments find themselves in today. Today, in communities across the country, the public health workforce is changing. Not only is the current generation of local health officers retiring, but it's becoming increasingly more important that today's local health department staff have the skills necessary to work across sectors, to question where and why inequality exists, to make data-driven decisions and investments, and to think strategically about how to meet the needs of their communities while remaining a relevant and viable agency. In addition to public health, other fields and disciplines such as community development and urban planning are reimagining their services and approaches to better support safer, healthier, and more resilient communities. Finally, the implementation of the Affordable Care Act is shifting how our country thinks about the meaning and the value of health. For example, health systems are developing payment structures that reward value, not volume, and more hospitals are engaging in efforts outside of their walls to improve their community's health. At NACCHO, the Membership Association for Local Health Departments, our vision is health, equity, and security for all people in their communities. With this vision in mind and an eye towards these changes in our public health ecosystem, the question for each local health department across the nation must be, what is our unique role and value? For some health departments, this means relinquishing their role as service providers to serve as health system navigators for newly insured individuals or as coordinators or conveners of population health services. For others, it means investing in new billing and reimbursement systems that align with the healthcare system's new payment structures. In our work at NACCHO, we are learning about hotspots of innovation and new ways of doing business in local public health. With each story, we hear that the challenges that local health departments are facing are complex, that making meaningful and transformative change really requires transforming long-standing habits and deeply held assumptions and values, that it involves feelings of loss and ambiguity about the change process, and that this work requires learning a new way of thinking about relationships and doing business. The paths each health department takes to improve its community's health may vary. However, if we understand challenges and change in this way, we can keep an eye on the more human elements of this work, which are just as important as the structural changes we see all around us. The ACA is an important catalyst in our country, but what is potentially more important is the indelible effect this period of change has on the culture, consciousness, and purpose of public health as a field and as a system. At NACCHO, we're not in the business of prescribing what health departments should do. However, we do believe that health departments that have a clear vision for their communities and make that vision heard, those that can discern between what's necessary to hold on to and what must be let go in service of change, and those that communicate the value of public health in a way that resonates with others, are able to remain nimble leaders in the face of change and will always be at the forefront of their community's needs. The vision for local public health during this period of change, uncertainty, and opportunity is only as compelling as the unified voices that articulate it. And much more work is needed to engage local public health and the strategy and actions necessary to lead in the evolution of our nation's health system. As we collectively enter this new era of public health, we invite you to join us in this work and look to NACCHO as a leader, partner, catalyst, and voice for local health departments.